Today on Dueling Doctors, we're talking about a topic that's very near and dear to our hearts, our pets. This is my dog Hoffman. Say hello, Hoffman. Pets are known to help us humans decrease blood pressure. They lower cholesterol, and they alleviate feelings of loneliness and depression. So what can we do for our furry friends to keep them as happy and healthy as they keep us? We're getting the lowdown on different vaccinations, foods, and mental health and behavioral issues. Different doctors from the world of holistic natural and conventional Western medicine square off on how to keep our pets' tails wagging for many years to come. And it all starts right now.
It's holistic and natural versus conventional health experts with different opinions and one goal, to help you live a healthier life. Dueling Doctors.
Hi everyone, I'm Dr. Frank Spinelli. Each week on Dueling Doctors, experts from the worlds of both conventional Western and natural holistic medicine join us to debate and discuss the best ways to treat some of the most common ailments and illnesses. Today it's all about pets. Let's get started by introducing our guests. On the eastern side of the equation, with classic veterinarian, homeopath, and certified acupuncturist, Dr. Marcy Fallick, and on the western front, from Animal Medical Center of Southern California, is Dr. Courtney Campbell. Welcome, both of you. Thank you for being here.
Thank you.
Our first topic is something that's sort of controversial in the medical community, vaccinations. Vaccines are intended to prepare the body's immune system to fight off an invasion by a disease-causing organism. Vaccines usually contain a dead or live weakened form of the organism introduced into your pet's body so that they can mount an immune response and fight off the organism if they're actually ever exposed to it. Are vaccines really necessary to keep our pets healthy? Each of our doctors has up to 1 minute to present their perspective, and then the other will be given the opportunity to respond. We flipped a coin before the show to see who would go first, and Dr. Campbell, you're up first. So,
Fantastic, fantastic.
I went and got a dog at a shelter, best thing I ever did.
Yeah.
And first thing they told me is I have to get all these vaccines,
Sure.
and I just did it.
Right.
What's your feeling?
Well, first, thanks for having me. But I think they want to make sure your dog is protected. And I think every veterinarian, their goal is to make sure that your dog is safe. And one of the most important pinnacles or pillars, if you will, parts of safety is going to be getting your dog vaccinated, protecting them away from diseases. Now, the reason why they have you do a series of vaccines is, just to back up for a second, is you're absolutely right. Once your pet is introduced to an organism, your puppy is protected from mom by a material called colostrum. Now, certain puppies do get this substance from their mom. It depends upon how many she had in her litter, how often they nursed, a lot of different factors. So because there can be this window of exposure, they want you to get a series of vaccines in order to protect them.
Now in most humans, though,
right,
we get vaccines, and then we may get vaccines again in 10 years, but I seem to remember, like, I had to go back the next year.
Sure.
Or, and I was very confused by why do we have to vaccinate animals every year?
Yeah.
When they have a longer period as well, like
Absolutely.
humans.
Absolutely. That's an excellent question. Let's be honest. One of the main reasons why annual vaccines or annual vaccination has been so popular is to have a client come into the veterinary office, and that is a veterinarian's time to assess your pet and actually get a physical exam and see how they're doing. But we know from studies now that vaccines last much longer than 1 year.
Right.
There are certain vaccine protocols that last up to 3 years, and recent studies have actually looked at vaccines that can provide lifelong immunity. So from my standpoint, if you want to minimize how many times your pet is being vaccinated, look at titers. Look at saying, all right, my dog was vaccinated at 16 weeks, which I think is absolutely important, and then look at the titers in your dog to see if they're protected.
Okay, so what are your feelings about tick protection, frontline, all these things I was told to do, and I just did.
All right.
I mean, honestly, I wanted to, what was best for my animal, and I just did it willingly and didn't question them. I mean, do you recommend that for your clients?
Here's the holy grail of protection for your pet. Vaccines, fleas, ticks, heartworm, and maybe intestinal parasites. Those are the 5. There's no medication that gets all 5 of them. And you usually have to use a combination of products in order to do that. Now, I think it's super important just to back up for a second. The diseases that we're protecting from are far worse than the medications we're giving. I get a lot of questions. Hey, doc, I'm applying this flea treatment. Is it safe? I'll tell you what's not safe. Tularemia is not safe. Flea allergy dermatitis isn't safe. Tapeworms aren't safe. Plague, Yersinia pestis,
Right.
these aren't safe. So if you're talking about is this tick prevention safe, being a clinician in Connecticut and seeing Lyme disease firsthand,
Right.
that's not safe. So that's the goal.
All right, that's a good argument. I mean, the disease outweighs the benefits of the vaccine, it seems. What did you have for
Well, I
Elaine?
have to say I don't disagree with him very much. I know that every vaccine has risks as well as advantages.
Sure.
So I am with Dr. Campbell in knowing that these vaccines can last even a lifetime. In fact, Dr. Ronald Schultz wrote the Bible of Immunology and Kirk Veterinary Manual, saying that vaccines last for a lifetime of the animal, and the only reason that we do it every year is to get them in. However,
But then why do the vaccine if you're just getting them in?
exactly.
That's what I want to know. Because now I'm feeling like I'm being scammed.
It's almost like that, but in a sense, you have to look at it in a more optimistic standpoint. A clinician's viewpoint, a veterinarian's viewpoint is, I would like to see Dr. Spinelli's dog every year to make sure he's okay. The only way he's going to come into my practice, one of the ways, is to get his vaccine.
Well,
now,
I think
my God, I
I
don't
don't think
know.
that one of the things that Dr. Campbell doesn't get is how dangerous these vaccines can be. Every vaccine can cause a litany of problems. And you know, I was just like you, I was trained like you. I gave my dogs vaccines every year and I didn't make the connection. And when I first learned that vaccines can cause so many problems, I really didn't believe it. But once my eyes were opened and I see that a month later, a week later, they have epilepsy, they have allergies, they have ear infections, they have cancer. Right now, for example, the vaccine-induced sarcomas is really big at the site of the rabies vaccine. It's irrefutable that you have cancer.
And what
from
are
this.
your feelings about Frontline and
Well, I think that is,
heartworm and tick
they
and
are,
fleas?
in my opinion, it's like burning down the house to get rid of ants. What are you left with? It's effective, but what are you left with? That it's extremely dangerous. It's poison. So basically, I have 100% flea and tick control with my animals. I use nematodes, which are little microscopic worms I put in the yard. They eat flea larvae. I use borax in the house, which...
So borax, you have it in the house, and you can. How do you apply that to your animal?
No, the borax you put in the... well, the thing is, this is the important point, actually. Only 1% of the fleas are in the adult stage. 99% are in the eggs and immature stage. So by just trying to focus on the adult, we're never going to get rid of the problem. But if we focus on the environment, then we will get rid of the problem. The animals, there are many things that you could do, like lemon rinses, garlic and brewer's yeast. You could spray vinegar and water 50-50 to repel the fleas and ticks. You can give them garlic, and not cats. Cats are very sensitive to garlic and to essential oils. But with dogs, you can use essential oils. You could use...
So there are alternatives to using a flea and tick preparation instead of using Harline.
the bottom line is this, right? If we knew that natural products worked for fleas, we wouldn't see this degree of flea infestations. So what I'm seeing in my practices are dogs who are on regimented flea control and we're preventing flea allergy dermatitis, which she views as being kind of insignificant, but to owners who are coming in every week and dogs who are suffering, to me that's not insignificant. Tapeworms are not insignificant. Seeing the recent tularemia outbreak in California, that's not insignificant. So flea control, when I'm using it in my hands, seems to be extremely effective with very minimal risk. For instance, here's a classic example, spinosad. You give it orally, that's actually an organic pesticide. So you've probably had spinosad if you've eaten an organic tomato. And we know that this particular chemical is extremely effective at killing fleas. And I haven't seen one adverse reaction except for mild vomiting.
Okay, if you don't look for it, you don't find it. I see it over and over and over again. People come to me, as the holistic vet, unfortunately, most people come to me after everything else has failed, which is what I would like to change with this program, to get people to come earlier.
This is a very intriguing conversation. I wish we could go on, but we have to take a break. When we come back, find out how you can stay ahead of the pack when it comes to choosing the right foods and supplements for your pets. Don't go away. Welcome back to Dueling Doctors. the show where health experts from the world of Western and natural medicine debate the best ways to treat ailments and illnesses that affect us all. Today is our pet show, and we're joined by classical veterinarian homeopath and certified acupuncturist, Dr. Marcy Fallick, and from the Animal Medical Center of Southern California, Dr. Courtney Campbell. The next topic up for debate is about pet food and supplement intake. Feeding your pets a well-balanced, species-appropriate diet is very important for their overall health. But if you're like me, it's hard to decide which brand is best, what kind of snacks to give your pet, and how much to feed them. Each of our doctors has up to 1 minute to present their perspective, and then we'll debate the pros and cons of each. Dr. Campbell, you went first last time, so we're going to begin with you, Dr. Fallick. I turned into my Italian mother when I got my pet. I was like force-feeding my dog. I was like, feed, eat, because I thought it made him happy. And I realized at the first vet visit, they were like, you're feeding your dog is too much. So how do you decide, or how do you advise people what brands to buy or what to feed your dog or cat?
Exactly. You know, about 20 years ago when I first started doing holistic medicine, I met a Russian woman in the park, and she said to me, she didn't know I was a vet, you know, I never met such sick animals till I came to this country. She said, we give our puppies one vaccine as a puppy, we feed them raw meat and bones and table scraps, they live till 19 years old, and I've never seen dental disease until I got here. And I said, boy, I wish I could film you, because this is what I have been learning recently, and I'm trying to tell people this.
So you believe in raw food?
I absolutely do. I mean, I was trained like this is species appropriate, just like you're saying. Biologically, they were supposed to eat raw meat, just like wolves and foxes out there. And what really turned me around, I mean, I was a vegetarian for 25 years, so the whole idea of raw meat really disgusted me. But I had a woman bring in a Shar-Pei, and it was the greasiest, disgustingest skin I've ever seen. It was on prednisone and antibiotics and thyroid replacement. She was desperate, and I had just learned about the raw food diet. I said, you know, I just learned, I'll try anything. I said, here, try it. She came back 6 weeks later, paid for a visit to show me the coat was like velvet.
So when you mean raw food, is it like I just go and I get a sirloin steak and I just cut it up? I mean, what is the raw diet?
Well, okay, so basically you can buy it pre-made or you can make it up yourself. So there are brands, like wonderful brands like Bravo, that get their food that's non-GMO, that's mainly raised, and they put things like bone meal and oil and different vitamins and everything else in there. So you could just defrost it, which makes it very easy for people that don't have the time to cook.
Okay, and any supplements you would recommend? Does an average dog or cat need supplementation?
If they're healthy and they're eating an appropriate diet, no, they don't need supplements. I mean, basically it has to be appropriate and healthy, meaning they need the bone meal, they need the veggies. When they're in the wild, these animals do not eat supplements. They eat the prey. They're predators, they eat the prey. Okay. So if it's a healthy dog, they do not.
So how do you feel about the raw diet for animals?
Listen, feeding your pet is basically like religion for some people. You question them on it, and it inflames passions because they feel so strongly, because we all want to do what's best for our pets. And for most people, they'll answer me a question, I'll say, what are you feeding your pet? They say, I have no idea, but I know it's really expensive. And so I guess the bottom line for me is, if you feed a well-balanced commercial dog food, I'm seeing pets live to 16, 17. I met a lab the other day that was 17 eating a commercial diet. Now, raw food specifically, we have a good body of knowledge that shows there are far more risks than there are benefits. For instance, as a therapy dog, if your dog is being fed raw food, you cannot go and administer therapy to the elderly, because you will be shedding organisms that may hurt the people that you're surrounding. E. coli, salmonella, Campylobacter.
So a dog or cat can carry this? And
not only carry this, not only do they carry this, right? Not only can they carry this and harbor it, but it can also make them sick. So as an emergency clinician, I've seen way too many dogs with E. coli infections from being fed raw food, salmonella infections. So the raw food company might say, that's not in our diet. Well, what company is going to tell you, yes, we have salmonella in our diet?
According to the CDC, first of all, there's not been one transmitted salmonella infection from a raw food from an animal to a person, number one.
We had 2 cats die on it.
Okay.
And those owners were devastated. One second, let me finish. Let me just complete this one thought. A lot of people like to promote that. They like to say, well, this is what dogs used to eat in the wild.
Right.
Well, we used to feed our dogs scraps after we were having fireside dinners. We used to toss them scraps. Right. So our Canis familiaris, the domestic dog, kind of grew up on scraps.
All right, we're going to have to take a break again. When we come back, it's time to talk treatment options for your pet with mental and behavioral issues. Stay tuned.
Fantastic.
Welcome back to Dueling Doctors. We're talking all about the health of our pets today. We've already discussed vaccinations, foods and supplements, and now it's time to talk about mental and behavioral issues our pets face. Changes in your pet's behavior may be a sign of fear, depression, or an underlying medical condition. It's critical to introduce your pets early to different people, animal, places, and situations so that they learn to become familiar with your lifestyle. If there is a behavioral change, it could be a reaction to a change in your life. Each of our doctors has up to 1 minute to present their perspective. Dr. Campbell, it's your turn to go first.
Fantastic.
I want to talk to you specifically right away with separation anxiety.
Sure.
A friend of mine got a pet. They flew it in. The dog was like 6 pounds, very young, and that dog since then has been a little yippy dog.
Yeah.
And I think it was because of the separation anxiety.
Sure.
What is your take about removing the dog too early?
Yeah, Dr. Spinelli, the challenge is this. 1 out of every 6 dogs suffers from separation anxiety. When you're looking at behavior in general, you really need to look at a sort of a complexity of factors. I look at pharmaceuticals and using medicines as a last resort. It's kind of like, would you talk to your boss about a new idea when he's having a bad day? You wait until the right time, and that's usually what you have to kind of approach animals in. You have to kind of soften them up to some behavioral changes. So working with them, for instance, you mentioned separation anxiety. Dogs, they're like having a panic attack. They don't know when you're going to come back home. They're pacing, they're salivating. They are really anxious. And
okay, but this has been years later now. This dog is like 9, and it's still very yippy.
And it can ramp up as they go on.
Chose to put this dog on I call it doggy downer.
Sure.
I don't know what's it seems like it's a sedative.
You're right.
I love it because when I go over there, it doesn't want to bite me.
Right.
But
that's the key right there, is that he put his dog on a medication, but medications have to be used. And I want to emphasize this really a lot. I want to basically say, always use medications in combination with behavior modification.
So behavioral therapy
with
a trainer?
Yeah, because it makes the behavioral modification easier for the dog to accept. I'm not saying medications should be used in every case, but I'm saying that a severely anxious dog, a dog who's basically having a panic attack, and who's mutilating himself, jumping through plate glass windows, which I had a case last week, dog injured himself, that particular dog may be a candidate for that doggy downer.
Okay, so medication is a last resort.
I agree with that, but I want to bring up a very important point, which actually ties together everything we've spoken about before.
I love it.
Just like in children, emotional and mental problems are much more rampant than they used to be. We're seeing so much more hyperactivity in labs that used to be more stable, fearfulness and aggression, and basically, I believe, in my opinion, it's caused by the vaccines in the food.
So you think this change in behavior in animals is directly related to vaccines?
Just like in kids, you see the ADD now that's happening, these over-vaccination of the children.
But there's been no real link
Well, let me tell you a link. I'm going to give you a link right here.
Give it to me.
When you give a vaccine, you avoid the acute form of the disease, but you give a chronic form. It gets the energy of the vaccines. Let me give you an example. With rabies, we know rabies, there's a change in personality. You can become aggressive. They start biting. They become very fearful. Just to give you a little short, terrible example, I had a lovely pit bull that I was treating, and they adopted, they rescued from the streets, a horrible beginning, and it was a love puppy. It would sit in its lap, and they would sit in their lap and everything. 2 weeks after the rabies vaccine, it switched. It turned, became aggressive. It bit the lip off. The owner had to have microsurgery. It went after the grandmother, and they had to euthanize it.
Do you believe that this could be caused by the vaccine as well?
And
absolutely
I
not.
know this also.
And it doesn't matter how loud she talks. The bottom line is this. There's no link at all.
There are homeopathic remedies to antidote the rabies vaccine. So there's a conclusive link.
It's way too complex. There's genetic factors, environmental factors, and individual host factors that
I see it over and over again. That you see that after a vaccine, you see a change.
Dr. Spinelli, 9 kids died in California from whooping cough. 9 children from lack of vaccination.
I'm not saying not to vaccinate.
So the bottom line is this. So the bottom line is this. Vaccination has been one of the sterling achievements of Western medicine.
Okay, so how about this? To break it up, because I want to get this point in. Sure. What do you recommend for taking a dog on a plane or in a car ride that might be natural that I can give my dog because he throws up when I take him to the car?
I use, well, first of all, Rescue Remedy, most people are familiar with this for stress. That can work very well with some animals. I use, it's a VetraScience product called Composure, and it's made out of colostrum and different vitamin Bs. It's very calming. I use something called
valerian root.
I use California. So there are many
well.
things for that, but basically what I treat is really deep chronic underlying anxiety disorders like you're describing, and I can reverse that with homeopathy. The food.
Before we talk about food, I just want to answer your question. So I am super open to homeopathy and natural remedies when it comes to behavioral issues and anxiety.
Okay.
No, I compliment him on his.
Well, we're going to have to go, and I have to say this has been compelling conversation. I want to thank you so much for offering all your insight. We'll be right back. Welcome back. We're in the home stretch of our pet episode, and whether you have a dog, a cat, or even a rabbit, the bottom line is we all need to take our pet's health seriously. Having a pet improves the quality and longevity of the owner's life. It has been shown that owning a pet lowers blood pressure, makes people happier, lowers their cholesterol, prevents heart disease, and owning a pet can help children with autism and ADHD. But pets are like four-legged children. They need love 24/7. If you are truly serious about owning a pet, I implore you to adopt one from a shelter, like I did. Adopting an unwanted dog or cat is so important because they desperately need your love. Adopting Hoffman was the best decision I ever made. Okay, second to getting married. Because he provides me with unconditional love and support, and that's priceless. I'm Dr. Frank Spinelli. Hope to see you soon on Dueling Doctors for more healthy discussion as you discover your path for your own personal prescription. And as always, please be sure to talk to your healthcare provider before making any medical decisions. We'll see you next time. Right, Hoffman?